I hit it and it turned itself off. Thank you for being here and for all your service. As we've already heard today, and you're already well aware of, this cap on the indirect fees for all NIH grants has been traumatic to the system. It's now on a pause. Clearly, the solution is some sort of more transparent, well thought out, fair system by which research in the center of the country, the South, the North, East, the West, is all in a level playing field. How long, let's assume that we get the legal stuff sorted out, the chaos comes down a little bit, how long would it take to create a new system like that?
Senator, I don't know that it would take a new system necessarily. I think the key thing is, as you said, Senator, the transparency, right? So audits of university spending of indirect costs would help, I think, help inform decisions. It's a complicated question. Of course, I wasn't involved in the decision about the cap, but if I'm confirmed as NIH director, that's something I'll look very carefully at. The broader problem is we have deep distrust by the American people of universities and the scientific establishment earned during the pandemic. To address that, transparency is the key way. Just as I was telling to Senator Tuberville, that transparency is what will solve this problem.
We agree on that. We've been working on a project called the Deandra Dixon Include Project Act. I think you know a little bit about it, but the idea is that we codify research activities at the NIH on co-occurring disorders of Down syndrome across multiple institutes of the NIH. And I'm not asking your endorsement, but I am asking if you'll be willing to work with us on this. We're very serious about it. And then also look at how more broadly on cross-institute work at the NIH to try and unlock new discoveries.
Senator, I'm absolutely committed to that, and I'd be delighted to work with you on that project that you just mentioned, as well as other projects. I think there's tremendous opportunities for cross-disciplinary work across the NIH. I think it's at the back of the minds of so many reform proposals at the NIH I've seen over the years to try to make sure that the NIH research doesn't stay siloed within one institute, but that it's useful for researchers all across the NIH.
Right. I want to spend a little bit of time thank you for that. I appreciate that. A moment just looking at, we've heard a lot of people suggest that somehow the NIH is allowing the United States to be taken advantage of in some ways. One fact that is striking to me that in a 10-year period, 99% of the drugs approved by the FDA were developed with research to a larger or lesser extent from NIH. Are you worried about the U.S. ability to maintain that leadership? Do you think we're being ripped off in some way? The fact that we are affluent enough and care about science enough that we are leading the world in this research, is in some way this unfair?
Senator, I think the United States is the greatest country on earth. And one of the reasons it is that it has a sincere commitment to doing fundamental research that benefits all of humanity. And I think much of the NIH research does exactly that. I don't view it as ripping off when a scientist comes up with an amazing idea that solves, that treats, diabetes better. Everyone on earth benefits from that.
Right.
So I think NIH as fundamentally an institution aimed at the public good.
So here's a more difficult question, which I've caused just to be suggestive. Do you think we're spending enough on research in terms of where you're coming in? Part of your seat is going to say, are we running out of good ideas? Is there a shortage of things that really demand our attention?
I think that, as I outlined in my opening statement, I think there's some real problems in how the scientific establishment is operating. The replicability crisis, a lack of desire to focus on the diseases and the conditions that really are inflicting Americans, and also a sort of tentativeness to focus on the big ideas. No matter what the budget is, I want to reform it in that direction. I'm happy to work with Congress. It's Congress that decides the budgets of the NIH.
We decided based on a lot of your advice. So be thinking of that. Obviously, increased vaccine skepticism. We're seeing just in the past school year, the number of kindergarten kids that are exempted for one or more routine vaccinations has continued to rise, the highest levels recorded. Is this rising skepticism around vaccines, is that going to make vaccine-related research at NIH any less of a priority, and if confirmed how you balance the need to focus on research into chronic diseases with that need to invest in research on viruses and things that a vaccine can address.
Senator, I think the increasing skepticism, which I view as a hangover from the COVID pandemic, sort of overstatement about how the COVID vaccine worked, makes it more important to do vaccine research. Secretary Kennedy has already said he favors the MMR vaccine. I agree with that. I think that research, I mean, maybe I'm naive, Senator, but I believe very fundamentally that research, if it's done right, it's replicable, is so persuasive that it'll move people to take actions. And that's the philosophy I've operated under my entire career. I intend to keep doing that if I'm confirmed.
From your lips to God's ear. Thank you.
Senator Moody.